the next slide.
Yes, ma'am. And I think I just started recording.
Okay, good. Thank you.
You're welcome.
So our primary goal today is to share the current status and get input on the COVID-19 safety precautions. But I will also, as the agenda says, talk a little bit about Chico Unified's decision last week, the additional survey and the additional survey that we plan to put out.
Can I scroll?
You can scroll, that would be good. Okay. So I showed this last week. This is from the CDC and their suggested, what to be aware of in reopening schools. So you'll notice as I go through the rest of the PowerPoint that these are the things that I am talking about, each of these steps. So, and as we go through this and you have questions or comments, please go ahead and type those into the chat. And then when we get to the end of the presentation, we'll go through that. That seemed to work really well last time, so I thank everybody for that. Okay, next page, Rachel. So the first question is
sorry.
That's okay, consistent with the state and local orders. And for Butte County and the Chico area, we remain right now within stage 2, which is and closer to stage 3 as far as our official place. And so at this point, it would be appropriate to consider reopening schools for Butte County. We are concerned, though, in watching the increased numbers in Butte County. The last 2 weeks in a row have been pretty significant increases, and this week is also looking to end up in the same place. So we are continuing to watch that, as I am sure the governor's office at the state is watching it as well. So reopening is currently consistent with our state and local expectations. I reached out early. Go ahead and roll it, Rachel. I reached out earlier this week to talk to both Butte County Office of Education and the Health Department about and Chico Unified about opening, and they are all still considering that it is appropriate to reopen. Can you roll down just a little bit, Rachel, so I can see the top? Great. So that was the first column. These are the next set of issues they asked us to look for. So the first one is, are safeguards available for high-risk students and staff? I've had a number of the families of high-risk students talking about their intent to remain off campus, and so we're giving that option of distance learning still to them. And if they are high-risk students that want to or need to be on campus, Rachel and I will develop a plan with the teacher, of course. We'll develop a plan for those students individually, as we already do with the 504 and IEP process. Roll down a little more for me, Rachel. Okay, they also ask about options for high-risk staff. And for that, we are also asking, and I've already put out for the staff members in those high-risk areas to check in on an individual basis as well, because everybody's different. And there isn't a way to have, this is what we're going to do for everyone, because there are different jobs and different needs. So I'm meeting with anyone who needs some of that more specific safety. So we are addressing the high-risk students and staff. And as far as screening students and staff for exposure, we are looking at a process through Parent Square where families can pre-screen. I'm spending a lot of time, or I have been, going to visit my mom in elder care, and so there's a pre-screening process that they use there that's pretty consistent with the health department also. It's a temperature check, questions about if you've traveled and if you have any of the symptoms. So, and have you been exposed to somebody? So those are things that we will put in place. Kelly asked a question, is distance learning only for those who are at high risk? No. The language in the law talks about it, but it also makes the statement that anyone who considers themselves to be high risk. So so that's a choice by a family to decide if they're concerned about the risk. So I felt pretty comfortable with just opening it up to everybody. Okay, next. Okay, so then the next issue they asked us is look about hygiene. And we are working on hand washing in every classroom. Also, what Chico Unified is doing is having hand sanitizer dispensers in each classroom. So I'm on Buck seeing if we can do something like that, which would be simpler than trying to figure out how to get water to classrooms that don't have it. So, that might be an option. So we're looking at that. Of course, we'll have practice, especially for the littles at the beginning of the year, on how to wash your hands and making sure you do it for 20 seconds and all of that sort of stuff. And then face masks will be provided by the school, at least 1 or 2 in the beginning of the year. And we do have face shields as well. The suggestion really is that what we need, though, is masks for everyone. And they will be required at this point because of the governor's order that everyone wears face masks. That is consistent with schools, consistent with the district. So I think that's going to be held by all schools at this point. We have a new barrier in the front office to protect from any passing of the germs there, just like in our grocery stores and other places. And our ventilation system at this point is pretty in pretty good shape. We were able to install, because we had a grant, we were able to install and repair 4 of the HVAC systems last year. We also were able to replace all the filters this summer. So the HVACs are in pretty good shape. We're having discussions about open windows or closed windows, depending on whether or not students have allergy issues or what the best practices are. So we will continue on that. And I will answer, let's see, Jeanette, requiring kids to use hand sanitizer, they would need to wash their hands regularly. If hand sanitizer is something they can't use and we need to wash hands in a different way, we can work on that. Face masks, it would be an exemption qualification. It would have to be medical. So if you're wanting an exemption, you need to talk to your doctor. Jean, thank you. Cleaning, this is both a big one and a simple one. Yes, we would be cleaning classrooms and the facility every day. The decisions as far as the schedule will make a difference as far as the classroom. I'm increasing janitorial staff in order to help with that. It's really, and then really the holding of cohorts together so the kids are not interchanging germs is part of keeping it down. So if we have any instances where we have to clean extra, that'll be, I'll answer some of the questions that are coming up towards the end. at this point. Rachel, you want to move? Go ahead.
I do. There was one thing, because you already addressed, Shar, it's probably really loud for you guys right now. Because you already addressed Jeanette with the exemption. If a student, if it is medically necessary and you do have an exemption, we're still going to ask that the child wear not necessarily a mask, but a shield to also help protect others around them and themselves. So, so I'd love to connect with you, Jeanette, about that exemption that you're talking about. And then we'll go ahead and keep going, and then we can, we'll get back to the other questions that are in there. Thank you.
And I forgot to have you talk about the face shields and the information you got on that. So
that's okay.
We'll do that later too. So social distancing, this is a biggie for us. We have, because of our specialties and everything else and what we're trying to work on with the schedule. So we want to keep the students in cohorts to limit exposure. So within their own classroom group, we know that we can fit up to 20 kids in a classroom with a 6-foot distancing. That doesn't mean we will, but we know that we can. And so that's one of the reasons we're looking at whether or not we can have most of the kids on campus who want to be on campus at once. Increased outdoor areas for class times. So often the teachers already take the students out to outside to do different activities. So we're talking about things like getting everybody clipboards so we can do more work outside, as that is been shown to be better for killing the virus and not passing it. Morning entry through various doors. And, you know, we have our longtime practice as kids come in the morning and then they go to the back and hang out back there, and then we get together, say our verse, and come in. Instead of that, we will be keeping as separate as possible all of the classes to come in. For example, if there's a door into their classroom, directly into their classroom, things like that. Our afternoon pickup, I think the thing that I thought the biggest concern right away I had was our pickup at the doors in the lower grades classroom. We're not going to be able to do that. So having the teachers take their class outside to an area to wait for children, and then working on a schedule for drop off and pickup times so that it's not so congested. And we have not worked out those specifics yet. Okay, and the last piece is ongoing monitoring, and then I wanted to talk a bit about the county response to cases. We will daily monitor student and staff health. We will ask parents to take their children's temperature before they come to school. We will also have thermometers at school to take temperatures and ask the questions. And again, that's part of a potential process we're doing with Parent Square, so that parents would be able to say, yes, I've done these things and this is what it is. And that, you know, sometimes that's hard because it's, you know, you're answering questions and realizing maybe the kids shouldn't go to school on a day where you really were planning for them to, and our need to protect each other. This is really about how we all take care of each other in this circumstance, and who you might be protecting. You may not even know that person, but we are all needing to think of ourselves as a community. And then I'll get a little bit into Butte County Public Health and what they'll be doing. They have a set of instructions that was supposed to go out this week, but isn't quite ready. and you can take it back down if you would. I just want to show a picture of it. Rachel, will you take that back down, please? Thank you. Um, it should be out soon. Um, but in the case that they find out that someone in our school has been infected, they will contact us and guide us through the necessary procedures. They'll ask us questions about our procedures. We'll be involved with their, I would say, their contact tracing. So we would be the ones to say that this is the class they're in, and these are the other students they might have been with, or the teacher, and so on. They identified, and I thought this was good for everyone to know, that prolonged exposure is considered within 6 feet for more than 15 minutes with an infected person. So that's the sort of information they would be looking at asking. And then if someone is infected on the school campus, there will be additional cleaning scheduled, airing out of the area that person has been in, and the potential of closing down that particular class, at least for a period of time. That's a decision that the health department actually makes, and tells us what to do. So that's okay. I think that's it as far as the presentation. So Rachel, you want to go back and read questions?
Yes, ma'am.
Thank you.
You're welcome. Let me move that and go up here. Get started. There we go. Have you considered how you're going to handle asymptomatic exposure?
My understanding is that the masks are intended to address the asymptomatic exposure. So by all of us wearing masks, it reduces, and also social distancing with the 6 feet. That is the way that we are told to address that issue. This again is a health department thing, not something that I am not I'm not a health expert. So I'm doing what I am advised to do from the health department.
Is Blue Oak independent from Chico Unified, or do we have to follow their plan for reopening?
No, we are separate from Chico Unified, and we will follow our own plan. We will be working on establishing that. Our board will approve it. We always take their plan into consideration, though, because we have so many families that have children in both, for example, in a high school on the at Chico Unified, as well as kids here. And so we have found, as we plan the calendars over the years, that parents have been really appreciative of having that consistency with the schedule. So we do take it into consideration, but we're not following it.
Specifically, who is the we of we will be cleaning and sanitizing classrooms daily?
We have janitorial staff, and clean, of course, is also part of we have a jobs process, so that would be part of that as well, where we are training the children also to do cleaning.
Can you talk more about what a cohort means?
A cohort is a group that moves together. So if we establish, for example, one teacher's class, Allie Welch's class, and she's able to have all of her students together, then that's the cohort that moves together. If we would have to split her class, then that would be two separate cohorts, and those children in those two groups would not intermix. So the idea is that then if there is exposure and there's 15 kids in that class, it's those 15 children. If we've done our jobs well, that's the group that would be affected, and not the entire school. Does that help, Summer?
Will temperatures be taken upon arrival to school by school staff, or is it self-reported?
It will be both. We will ask parents to self-report, but we will also take temperatures when we get to school.
How and how often and where will, sorry, I lost it. How often and where will staff be tested? Is that mandatory and happening at the school as regulation?
There is not enough testing for the schools to have testing at the schools at this point. My work right now is to try and make sure that teachers are and school staff are considered priorities in getting results back when tested. So that's what I am pushing for at this point.
Will you be increasing staff for the daily health monitoring?
That's a good question. I don't have an answer to that one yet.
Rachel and Susan, sorry to jump in, but Rachel, you skipped my question in the chat bar.
Yeah, I just saw that. I was about to go back.
Great.
Do you want to ask it?
Yeah, sure. I'll just read it if
Okay.
I can find it. Okay, so there have been a number of daycares and summer camps over the last 2 months that have followed very strict precautions, yet COVID still spread rapidly. It seems that these precautions are not working, and so wouldn't it be better to start with a fully online model so that we don't go back into emergency mode when a case emerges and risk endangering and losing lives? So that's
Possibly, Nick. I think, we are looking at what's going on in the community and that expectation that we are fitting the needs of all the community. What I feel like we're doing first at this point is developing the plan for when we do come back to school in level 2 and 3. Of course, our hope is that we can do it on August 18th, and 4 weeks ago, it was absolutely my expectation and the expectation of the staff that would work. With the numbers that have gone up just since July 6th, a lot of people are reconsidering that, including ourselves. But in the meantime, we need to plan for and make sure we've gone through the process. So when it's time to open them, we already have a plan in place. We're not trying to rush it at that point. Rachel?
Core, how is health and safety measures impacting the budget? How has the state funding deferral? So how is the state funding deferral and how is that impacting our budget?
So some of the issues like buying the face masks and additional hand sanitizer and that sort of thing is actually 75% of those costs are paid by FEMA through a grant we're receiving from that, or will be a reimbursement. So there's quite a bit of that that's going on. We also have funding from the state that's specific to COVID-19. So for example, we purchased the Earth School materials, which is Waldorf distance online learning materials. Those would be part of the state grant. So the additional costs are always a concern. However, a lot of it at this point, those sorts of things we're continuing to get additional funding for that. It's not enough, but it's also not going to put us under.
This is a good question. It's probably something we should do. If there is a child with a mask exemption in someone else's classroom, in their own child's classroom, will all the parents be made aware before the school begins?
That's a good question. I'll have to look at what my legal requirements are there, but to me, it sounds like it would be sort of like a peanut allergy that you would want people to know
Right.
about it. So, but I will have to check my the whole legal sharing of information thing.
I took a picture to make sure that we, so I can go back to that to make sure we address it.
Okay.
Um, will teachers and students be, okay, wait, Rebecca, agree with the plan for disruption due to positive cases? Will teachers and students be isolated for 2 weeks if there's a positive case?
There's a whole process depending upon whether the case is actually in the classroom or whether or not they're exposed to the case. So that's actually a decision that the health department tells me. So it might be 2 weeks, it might be 5 days. It depends upon um, it, what they decide the critical situation is. If somebody's actually infected, if they're in school, I imagine that's different. Um, and again, I'm not the health expert. I'll have them tell me what to do. The main thing we can do, though, is make sure that we're following good protocols so that we can limit the amount of exposure that we have.
Can I ask a follow-up question?
Sure.
I'm like, who is that? Yeah.
It's a question asker, Rebecca. I guess my question was, because the slide said that students would be distancing 6 feet into the classroom. If someone in the classroom tested positive, would you consider the students in that group or that cohort to have been exposed if they're presumably, more than 6 feet apart?
That, and Rebecca, that's a health department question. So if that comes up and we share our processes and can say this is what we've done, it will be up to the health department to decide whether or not we've done it well enough so that they're not exposed. I mean, that what they've said to us, as I put in the last slide, that more than 15 minutes within 6 feet. So if we can say, no, this child was never within 6 feet of any other child or parent for 15 minutes or adult, if we can say that, then we've isolated that situation. I'll go just to kindergarten, but I could say the same for 7th graders to guarantee that 7th graders are going to stay 6 feet apart from each other when they're in class together. I don't know if I can do that, but we're certainly going to try.
So bear with me. I know that I have 23 messages that I haven't even looked at. So I'm still working from the top. At this point, do you know how long students will be in the classroom together?
That's part of the schedule that we're talking about right now. I wanted, again, as I said, I wanted to wait until Chico Unified presented what they were going to do, because that's often a consideration for our families as far as what their schedule is going to look like. But my intent now is to write up first a survey for teachers about what they want to do, and then move forward with a survey to parents as well, based on what the teachers feel they can do and what that looks like. So I'm looking at having some good answers for you by the end of next week on that, maybe by the meeting next week.
If someone in the Blue Oak community happens to pass away, is there a notification that will go out to families? Will there be counseling services available? I mean, I know this is something, I'm just speaking now away from that question, Jody, is I know that Blue Oak community has unfortunately gone through that. So, so I'm sure that they have something in place.
Yeah, we definitely would have that. We also, when that sort of thing happens, lean on our local education, other local education agencies like BCOE came to our aid when that happened in 2017. And yes, there'll be a process.
How big are the cohorts?
That is another question that we're going to work with. I want to work with staff on. It could be, as I said, up to 20. I'm not sure I'm comfortable with that number. So we need to talk about it.
Request for clarification.
Mhm.
Children as young as 6, so in kindergarten or first grade, will they be at least partially responsible for ensuring sanitized classrooms?
I'll have to work with the teachers on that just to know what the expectations have been in the classrooms previously.
Jody, do you have a question?
The original answer that Susan had given of who's the we
Mhm.
included that's part of the jobs process.
Mhm.
So then the answer to that would be yes, children as young as 6 would be expected to be part of the sanitizing process if the original answer still stands. And so then, of course, the follow-up to that is there any part of where we consider that problematic that we would be saying the way that we protect our classrooms and make them safe and sanitized is that we rely on 6-year-olds who are doing their end of the day jobs to make that be a thing that happens? Is there any part of us that goes, what?
Well, and that's exactly why I backed off on that answer a little bit, Jody, is because I'm really not, when it goes down to kindergarten and first grade, when we're really still in training for that, I would have to talk to those teachers about that process. But cleaning and, wiping and in fact sanitizing is part of what we do. And so having a child wash their own desk would be a normal thing. Um, so I think we need to get back to the chat and continue on our process, Rachel.
Nick, I do see that your hand's raised. Is your question in the chat box lower?
I have a comment directly related to this, as I've been a teacher for 4th, 5th, 6th, 7th, 8th, and I would not even trust 8th graders who had to do jobs to correctly clean a classroom in a way that would protect other people from getting ill. It was pulling teeth to do 7th graders. And so, I mean, like, I've taught for 8 years at Blue Oak, and getting the kids to do jobs is impossible. And so, like, entrusting the health and safety of others when they won't even pick up the eraser underneath their desk, I mean, I'm just really worried about that. So I just wanted to speak to it in this moment, since I felt my experience directly related to it.
Thank you. If the majority of your classroom, Nick, or a classroom wants an online situation, is that a possibility to look at for teacher by teacher?
Yes, and that's part of the survey that we need to go out and find out how much, what the balance is. And part of my going through the series and doing the survey is to find out where we need to put our resources. So if I find out as we come in over the next couple of weeks that 40 to 60% of the students our parents want to be online, then that's the direction our resources will go. So that's what this discussion is for.
I think you already answered this question. What happens if someone tests positive on campus?
Yeah, so that goes back to the health department giving us direction as to what we are to do.
What will bathroom usage and sanitation look like?
I am still working on how to do the bathrooms.
Ty's question, which I think you kind of just spoke to it, was understanding that a plan to open the school is important. Is the same amount of work going into planning for distance learning?
Yes.
Um,
We've been doing planning for distance learning since March and talking about Google Classroom, surveyed the teachers on what kind of training that they need in order to move forward with that, and are planning our in-services around that process.
Just as a follow-up on an earlier question, is Blue Oak hiring more janitorial staff?
We're readjusting in order to increase our janitorial staff.
Jody. My question regarding health insurance was skipped. This isn't a platform really for health insurance. So that's something that if you wanted to talk to Susan or I independently, you're more than welcome to do that. What measures are being put in place to minimize potential spread between cohorts and common areas, such as hallways, on the way to and from classrooms, and the drop off and pickup areas?
So the kind of things we're looking at is to minimize the hall usage to the extent possible, to have entry into the building if a hallway is needed, for example, where the 4th and 5th graders are, to be that entry as close to their classroom as possible, and then to space the times when they come in and go out. So those are some of the things that we're looking at putting into place.
Brittany, Jones has a question about a sub list, and that, you know, what if she has her child and Miss Adams has her child and Miss Grant has her child. So if they end up needing a sub, have we thought about that? We have most definitely been thinking about that.
Yes, it's one of my big questions, is how are we going to manage replacing the teacher when they are not able to be there for a class?
Mr. Combs has a question about how much learning can we expect to happen. And Mr. Combs, we're going to try and have our kids learn as much as possible. This is totally a different world than we're living in compared to the semester before last. So as much as we can make them feel safe and loved and learn, that, of course, we want them to learn as much as possible. If
to address that a little more, you know, the things that help children learn that this meeting is really about, in these meetings, is to do our best to make them feel safe. And when they feel safe, they're able to learn. And so if we and we also know that if they have routines, that helps them with that sense of safety. So as we can get those things into place, we will do better for their learning overall. That's true every day, and it's true today too.
If a teacher or staff tests positive, do they end up quarantining for 2 to 3 weeks? And
that again is a health department direction to me, and they will do that sort of contact tracing. They're looking at, but that's what's in, that's like 10 days, I think, is what they have in the document.
So here's an opinion from a worker from Enloe, and she's saying if all students have a mask on inside the classroom, that they don't feel like there should be a need to isolate all members of that class if everyone's already been wearing a mask. So that's something that, you know, we can consider, but once again, yeah, CDC and what Butte County Public Health will end up guiding us. How will parents be notified if a teacher or student tests positive?
The Department of Public Health will call you. Doesn't mean we won't call you too, but officially you'll get that information from them.
Can we have a dedicated parent volunteer for each class that would be part of that cohort to help teachers at the beginning and end of each school day? So nice of you.
We can consider that.
Um,
I've pretty much been saying no parent volunteers because that's the sort of the direction from the CDC. So we'd really almost have to address it as a job, in a way, not paid, of course, but just if you're going to be the one that's there every day, we can't like rotate it through. So it would have to only be one person, and that's.
Cindy's asking, she's saying Governor Newsom is having a press conference tomorrow regarding decision to reopen schools. Do you know or have an idea about what will be announced?
The rumor that actually I think was published in the Sacramento Bee today is that he is thinking that counties that are on the watch list will be only doing distance learning. We are not Butte County is currently not on the watch list.
How can parents know whether they will choose to send children back to the classroom before knowing the full procedures in place?
Repeat that. I'm not sure I got it all.
Okay, I'm sorry. Before I go on, I just saw another comment that really needs to be addressed. I have someone that is very emotional right now, which makes me emotional. So please stop talking inside the comment box about death and people dying, because it's really, really upsetting to them. So just putting that out there. If that's something that you feel like you really need to drive home, then please send that message, those types of messages to Susan and myself. But it's very hard, especially since we've already had it at our school. Will you have people on site to monitor the bathrooms to make sure that faucets are cleaned and sterilized, that seats are cleaned?
Yeah, the bathroom issue is a big one, and I'll just honestly put that out there. We're exactly what we need to do as far as there are sprays, for example, that can be done. How we can monitor who's going in and out of the bathrooms. That's still a possibility. So thanks for your suggestion, and we'll consider that as part of it as well.
Cheryl Grant has a question. Did you say a survey was going to be going out to families and staff?
Yes.
How will the music and elective program work with the smaller cohort model?
So there are things we're talking about or that are being talked about, like band would be outside, what instruments may or may not be used. There's a lot of those. The actual electives that mix students would not be something we'd be doing. So a way of keeping them separate. And we did that through distance learning this last fall pretty successfully, or last spring. So pretty well. So yeah.
If I think it was already answered again. If they sorry, I was thinking about another comment.
Do you want me to transfer to somebody else?
No, it's okay. This question has nothing to do with the comment.
Okay.
Will there be an option for online, even if regular classes are in session?
Yes.
Because we continue to refer to health department protocols, will those protocols be sent out so other people know what those protocols are?
Yes, they've shared a document with us, but told us that it's for internal use only, and I've shared that internally with all staff. But They haven't finalized it to the level that they want it shared publicly yet. And I had hoped they'd said they'd have it by today, but they don't yet. So I know that there was a little bit of a snafu with the governor's conference and things that waited for that. I think there's also additional information coming out from the California Department of Public Health. So um, it's close. Hopefully it'll be available to all the public and probably posted on the website within a week or so that you can see it.
Yeah, Maggie, can you take over? I'm at
Okay.
Ty O'Neill at 522.
Okay. Follow up regarding distance learning planning.
Mhm.
I'm hoping that it will look significantly different than last spring, more real-time student-teacher interaction using use of technology to enable and moderate student group work online, etc. Is this a realistic expectation?
I'm not that is better than what happened in the spring is absolutely a realistic expectation. Whenever we have teachers that have never taught online before. We don't even use technology in our classrooms very much because of our belief in our pedagogy. And so flipping that from total group work, always together, to now we're going to do this online, that was big. And we also didn't have, and this is throughout education, throughout California, it's not just Blue Oak, that we just don't have, we were all just thrown into this, and either schools did not open at all for like 8 weeks, or they did a rush job like we did. And we went along. That's what the county decided we really wanted to do. We wanted to keep kids engaged. We were concerned if children were sent home and left at home with no content or connection at all with their school community, that would really be harmful to their mental health. And so we really focused as much on making sure we were making those connections and making sure that kids were safe and feeling cared for as much as the academics. So yes, as we move into the fall, we have learned a lot. We've surveyed teachers about what worked and what didn't work, talked, and we will continue to talk about how we can better use Google Classroom. Now, if you want, if we have our teachers teaching on site, I'm not sure, you're saying you want synchronous instruction. I'm not sure to what level that will happen, Ty, if feel like that was enough. But also we have, we're looking at a variety of use of specialties and other things to make that more possible. So.
Thank you.
Mm-hmm.
So I'm seeing a lot of comments, not a lot of constructive questions. And I would like to add, if we can just keep our questions respectful, that would be really helpful. I understand that tensions are high and everyone is frightened and scared. My husband's a teacher. I understand this situation very well. And we are, doing the best we can with the information we have. Looking for, I have a question asking if the children will be responsible for cleaning toilets and sinks before and after each use.
As I said, we're still working on the bathroom procedures.
Sheila had to check out for a minute because her internet connection, I may have to let her back in, and I'm not sure how to do that. I'm not the meeting leader, so
I just let her back in. Thank
did
you.
you? Thanks, Rachel. Okay, and we have some parents that are concerned about the stress that is going to be on the teachers. We are very well aware of that and are considering all of those things. Have the teachers been surveyed? I'm not sure what that means. Rebecca?
Yeah, my question was just like similarly to how Blue Oak has been or will be surveying the parent community. I'm curious if there's been like a similar survey with teachers, and if so, I'd be interested in hearing that. I guess nobody wants to be like, I demand teachers return to school. If teachers who are also reading the same information as the rest of us, don't feel comfortable. So I was just curious. Someone did point out that there's a lot of staff and faculty on this call, and it's nice to have everyone here.
We are also, Rebecca, having last week and this week, we've been having all staff meetings as well. Those are on Wednesday morning. So a lot of the same information is also available through that process for the staff, just to talk about what we're doing. So we're getting input at this point in that way. And as I said, as far as the schedule goes, I'm also looking at putting out a survey this week for them.
That's helpful. Thank you.
Mm-hmm.
So I have another parent asking if teachers are going to receive hazard pay. Those are all things that are going to be discussed directly with the employees and probably not appropriate for this setting. But absolutely, we're looking at all of those things, how we're going to determine paid time off, all those different things if someone does become ill. Sarah, Susan, it is very hard to hear you. I know this has been mentioned already. Could you please lean into the mic?
I'll work on that, yes.
Laura, can you explain a little bit more about the safety in regards to lunchtime? I know a big problem in hospitals is transmittal between staff in break rooms while eating. Where and how will students safely consume lunch and snacks?
So Blue Oak has historically eaten in classrooms, which is what is being suggested by the CDC. So we'll continue to follow that method. The thing that is changing is the expectation that there will not be a lunch line or that sort of joint service where you sit and wait and then pick what you want. So it will be more of a brown bag, which we often do on Thursdays, a brown bag lunch that's available through the school. And so that's the direction that we're receiving on serving lunch. So again, within their group, their cohort.
I'm not seeing any more questions, but I'm feeling like maybe we have missed some. And so if someone has something, they may need to retype it. Here's another one. Are there any updates on what childcare will look like in the AM, PM schedule or morning only schedule?
Repeat that again. I started looking at.
Are there any updates on what childcare will look like in an AM, PM schedule or a morning only schedule?
I'm still working with CARD on what the possibilities are and how we can both supply that and make it affordable for families.
If a family begins in class, can they change to distance learning if they are uncomfortable or back again? I think they just want to know if they can change
Yeah,
the course.
so I don't see any reason why they wouldn't be able to move to distance learning. Moving back into the class will depend on numbers because I'm not going to increase the numbers over what we would want to have safely in the class if somebody has made the decision not to be in the class. Um, so it depends.
When someone tests positive, will the entire school be notified or just the class?
There may be some more variations on that. We generally don't, for example, if we have a case of lice, we don't inform the entire school. Um, so I don't know what the health department again will expect us to do on that.
Carrie Smith, in Butte County, it is currently taking 3 to 5 days to revive a test and another 10 days for test results to be back. What happens in the interim? I think she typed internet. Such a child is sent home with a fever, such as a child being sent home. Will there be communication with families?
Yeah. So if a child who has had a fever in the class, will we communicate that to the families? My expectation would be yes, but I would need to again do check my protocols.
Any other questions? There's one. Other charter schools are holding the space of children who choose to use Oak Ridge in the fall. Will Blue Oak do the same?
Probably, sure. I don't see why not.
Excuse me, sorry. My screen is telling me that chat is disabled. Oh, it just fixed itself. There we go.
We have a parent wondering what we're going to be reviewing next week.
Next week, we are scheduled to talk about distance learning.
Will any new students be enrolled throughout the school year?
If there's room in the class, yes.
Has anyone at Blue Oak tested positive or have symptoms?
No, not to my knowledge.
I know this is a safety meeting. When can we expect more info regarding what in-person schooling looks like? I think we just answered that next week. How can parents complete surveys when there are so many unknowns?
Well, that's what the survey's for, is, basically to judge what you're thinking about right now. Are you interested in doing on site? Are you interested in doing distance learning? What kind of schedule would work for you? Um, you know, this is unknown territory and has been since March 13th. Things have changed every day so rapidly that we still need to move forward whether we know everything or not. And that's, when people talk about maybe we shouldn't be opening in the fall and we have a month left, that's where we are right now. We make decisions based on the information we have today. And so we do the best to put forward our best idea of what we need to do right now and plan for that, and also have that flexibility to move with the river as it runs.
Do we know what day the survey is going to go out?
I am estimating it'll go out on Saturday or Sunday. I want to be able to survey the teachers with information based on the Chico and also the potential of what the governor is going to talk about tomorrow. So I want to be able to do that before I put the survey out to parents.
How can we know what we are interested in if we don't know what the options look like? If we don't have adequate information about scenarios to determine whether we would send a child to school or not?
Well, I think that if you're concerned, we'll put the options out. But if you're concerned about not wanting to send your child to school, then I would suggest you keep them in distance learning if you can afford that, if you can do that and support that option.
Thank you, Susan. Thank you, teachers and staff. I can only imagine your situation and position in this. Tough for all. Every day we get new information. There's another. I am greatly encouraged by the American Academy of Pediatricians endorsing the return of children to classroom teaching method. This is after the Academy reviewed the science. Another comment, I would just like to say that I would need to know if there were children with mask exemptions in my child's class and have a better answer about how positive cases will be reported to the student body before I can make any decisions. I know it's not a question, but I need to express that. No pushing for an answer now. Another comment, I think you guys are doing very well. There are a lot of unknowns, but your communication is appreciated so much. I know of many other schools that have had no communication with parents. This is really hard to figure out. I appreciate the thought and time that is going into this planning. Thank you. I have to go. Parent exiting. Are there any other questions?
Maggie, this is Jennifer Glennon. I'm unable to type. Can I ask my question?
Absolutely.
Okay, my question is, if we accept the reality that having school open creates risk, and parents who want to avoid risk are able to keep their children at home, my question is, how can we foster community in our parents and our faculty to not think that some people who are trying their hardest are going to harm them, or I'm just feeling like there could be a lot of conflict and divisiveness in our school community. And I'm wondering if we can start to think about proactive ways to make sure when we come out of this on the other side, we're still strong together as a community.
I'm not sure that's a question, Jennifer, but it's a really good comment. I appreciate it. It's something we need to, again, continue to care for each other and work on that process. Anytime you have this kind of thing where it's just so, this is divisive not only in the Chico community, but in the world community, in the US especially. And quite often those things are reflected closer to home. And so how do we be the example of how we can get through this together with all the concerns and supporting everybody in a way they need to be supported? Okay, I do my counting to 5, and if there are no more questions, I just really thank you all for being here and for your questions and concerns. If you don't bring them up, we don't know what it is we need to address. So really do appreciate it. And we will move forward and hopefully see you next week again. Thank you.